So you all were sort of at the forefront of the stay-at-home orders. How long have you been at home?
So let's see, it kind of started in mid-April. No, early April is when it started. It was interesting. So in California, we had, I'm in Southern California in Orange County, and we have offices throughout California. So, we were kind of on real time, hearing, hey, by the way, these two counties have issued a shelter in place and you need to shut down the office by 5 o'clock today. So we, in a relatively quick time, had to go through and we had been anticipating things. So we were, gearing up, but in a really short time, we had to, move over, 800 employees to working remotely, to make sure, one, they're safe, and two, then we had to work on, how do you get supplies? Not everyone was accustomed to working remotely. More of our field folks, sales and service staff, they're traveling, they have computers. We have a lot of folks that don't. And then, we're trying to find, 200 laptops and printers and Wi-Fi systems. And then we have to expand the people that can dial up into our system so they can, have access to things to take care of our customers. And it became challenging going through it, but super proud of how the company responded and how quickly we're able to get up and running.
Yeah, and we're hearing lots of those stories like, hey, we didn't realize that we needed to be able to, ship some office chairs to people because they can't really be working at their dining room chairs all day. Or, boy, it's been incredible to realize how reliant we all are on multiple big monitors instead of just a laptop monitor. So lots of folks making those adjustments for sure.
Well, I had people asking me, will I have my dual monitors? And I'm thinking, all I see is my laptop and tiny screen. I'm like, you have two monitors?
Yeah, it's pretty amazing what we've become used to. So you mentioned, offices in various locations in California. So you're doing a lot of work in the public entity space, right? A good portion of your work at Keenan is in the public entity space, a lot of JPAs in particular, but you have those relationships and networks with public entities and non-public entities alike. So I'm wondering, just based upon what you're working on and what you're hearing and all those broad relationships that you have, what kind of impacts and issues from that broader network do you see that you think JPAs and pools ought to be thinking about?
Sure. So actually, Keenan, we're now owned by Assured Partners, which is a national, actually international organization. So they've bought about 350 agencies around the country. And so we're essentially the public entity arm and hub in California. But about 90% of what Keenan does is public sector. So public agencies and joint powers authorities. So we work with about 60 joint powers authorities and about 700 public agencies in California. The other part of our company is healthcare, which is hospitals and medical groups. So we do a lot of consulting with, large hospital and healthcare systems. And so I think what they're going through, as well as what I hear from the other agencies that we're affiliated with around the country, is, the economic impact of COVID. There's really two big things that COVID's impacting. It's the emotional aspects for everyone in terms of what we're all feeling and dealing with. And then there's the economic impact, both individually as well as what society's going to face. And I think with our healthcare clients, it's pretty symbolic as to what the economy's facing, as they have, significant revenue impact. So even though hospitals are some of the busiest entities right now, they're not able to charge for services, right? It's the testing of folks that have the coronavirus and taking care of those folks, but the elective surgeries, the non-essential, types of services, they're not charging. So we have healthcare clients where their revenues have decreased over 50%. So that's I think symbolic of what's happening in terms of what this means to public entities or pools primarily. Is this impact is going to be felt in all areas. And so if you look at a particular geographic area where there's less, I'll call it house tax, so less sales tax, property tax, personal income tax, that's less tax revenue going to a jurisdiction, whether it be a state or a county. Those are the monies that typically fund public agencies. So I think as we project this out, in terms of, is this going to be a, hopefully shelter in place gets removed, but I think the impact we're going to feel for several years on this. I was reading a report this morning that Moody's had put out in terms of a stress test on different states and who's best equipped or least equipped to kind of deal with what the economic impact is going to be. So when we look at pools, pools rely upon investment income for initial funding, right? They're going to discount their funding, and if they can't discount as much, that's higher rates to the membership. But when we look at existing claims where they rely upon investment income on claims that have a longer tail, when we're seeing social inflation, which is increasing the cost of claims or quicker payouts, coupled with now lower yields on 10-year bonds, on muni bonds, I think that's going to have a significant impact on what pools feel.
Mm-hmm. Yeah, so that investment issue is an interesting one. I was really, as you were talking through the healthcare organizations that you work with and what they're experiencing, that's a really good similar story, I guess, to public entities and what you're talking about in terms of revenue, right? So both the healthcare systems and public entities provide a lot of those safety net services that they have to keep providing no matter what, and yet the funding sources for those entities is eroding and is a little bit more of an unknown. So how do we keep providing those safety net services when we don't have good revenue projections? I think that's a really similar circumstance for sure.
If you look at a city that relies upon so much with hotel tax, sales tax from restaurants, and sales tax from people purchasing cars. And right now, hotels are shut down, restaurants are shut down, and no one's purchasing new vehicles.
Right.
So I think there's going to be a very similar to what we felt in 07, 08 in terms of a slowdown. And it's typically, slower to hit public agencies.
Yeah.
So we'll be slower to feel it, but we'll be slower to come out of it as well.
Yeah, that's really good perspective to have. So what about the JPA clients in particular? What are you hearing and seeing from them? What are the top trends that you see them facing right now in light of COVID, or the impacts that you see coming down the line for them?
So we, I just finished the renewal programs for our JPAs. And so, dealing with reinsurers around the country, whether it's, London, Bermuda, or domestic, I would say pools are going to be confronted with, different aspects of diminished coverage. Diminished coverage being that, the reinsurers are going to require now some sort of pandemic or occupational disease exclusion to really clarify the intent of coverage, number one, and number two, really make it clear that the pollution exclusions do indeed exclude pandemic exposures, because there was some vague ambiguity in that. So I think that, we're going to see those types of exclusions become now just normal with policies, just like, we'll see a terrorism type of exclusion on it. And until the federal government develops some sort of backstop program like they did with TRIA, and I believe they will do something with pandemics, I think it's going to impact pools. And, for the different pools out there, I don't think it's going to be as much of an impact for scholastic pools, because I don't think we're going to see the same level of, third-party claims coming in against a school district as you might against a city or county that's not shutting down, or that their health inspector didn't do something appropriate, or that has first responders. So I think you'll see an impact on all insurance, but depending upon which type of public entity or public agency, the impact will be a little bit different.
Yeah, those reinsurance renewals, both in terms of pricing and also in terms of coverage, and just the terms of communicable disease exclusions and pollution exclusions, that's certainly one to be mindful of. I've heard more focus on the communicable disease exclusion, and pollution is almost sort of secondary as a note. Did you see those as equal conversations when you were working through that with your JPAs, or was it mostly focused on communicable disease?
Well, I think there's some folks that feel that, that the pollution, that there's potential coverage under pollution,
Right.
For this. And I don't think the intent has ever been for a reinsurer to say, hey, yeah, this is, when you have a pandemic, that our pollution coverage is going to apply. Right. It's more for the sudden and accidental. And now you have different attorneys that are saying, oh, well, it was sudden, it was accidental, the COVID sitting on, the counter in your office, and that's what really caused this issue now. So I think it's more to clarify things.
Yeah.
And in addition, I think we're seeing, different states are doing things. I can speak to California most specifically, but the impact it's going to have on workers' compensation now. And even though we went to shelter in place, which definitely helped, keep people safe initially, there's an executive order that we believe is going to be signed in this next week by our governor. That's going to basically make the COVID or coronavirus a presumption now. So, it's going to be an automatically accepted claim that it happened or arose in employment. So again, that won't have much of an impact for a scholastic type of entity, but for a city and county entity, it would, because it's going to apply to first responders and healthcare workers. So if you're a county that has police, fire, or county-run hospitals, that's going to be an impact.
Right.
If you're a school district that doesn't really have first responders, it's not as much of an impact, but the projections on what this will mean to the cost for workers' compensation, they're saying as high as $35 billion into, workers' comp costs. So I think that's going to have an impact, obviously, for entities. And then, the other big issue, again, depending upon how long this goes, is, how do JPAs adapt to this new world of remote servicing of their members? So if we have shelter in place and entities have some sort of, new world that they're living in with shutdowns, but we still have regulatory oversight. So there might be safety preventive inspections that need to take place. So we have a department that does chemical hazard inventories. And so, we're helping agencies, we're doing their hazmat plans, their inspections of their premises. But they're saying, but we don't have anyone on the premise and we don't want to send anyone to that premise.
Right.
Which is valid. However, when the regulatory authorities say it has to be done within this time period, it's just a new challenge. And I think there'll be, a relaxation of some of the rules and regulations. But I think the longer this goes, the more new items pop up. And we just have to figure out how to best adapt in kind of the new world that we're living in.
So what about Keenan itself? You're working with 60 JPAs and you've got other public entity clients. Is there anything that you're doing new, different? Are you working with services different? Are there new products? Where are you in making sure that you're responsive to the needs and just putting things together for clients in a way that makes sense?
So we like, every other entity in America have a COVID resource page,
yeah.
Right? So, and so what we tried to do is really a couple things. We try to there's so much information that's out there that everyone is getting inundated with, and everyone has the right intentions, right? The best of intentions to sharing this, but it's, at some point it's a bit of overload. So we created our COVID resource page to try and take the information and say, okay, how can we at least put it in a way where it's best usable and folks can go to it and use it as they wish, as opposed to us sending all of their stuff. And so, we did it around, here's what the regulatory information is, here's some training information, here's some information from the health insurance companies so you can deal with what your coverage is, whether it be, EAP type, programs and services that you need, health-related services, just legislative best practices, all that. So we have the resource page that's on the, Keenan website that anyone can go to. But what we also did is we created a micro learning training program, and that's on there as well. And they're just short videos. There's 9 videos. They're 3-4 minutes each that you go to. But we have a lot of folks that are working remotely now, and they have to adapt to new things. And so they're kind of loss control types, training, but it helps people adapt to their new space. And so how to set up a proper ergonomic station when you might be working at your kitchen table,
Yeah.
right? So it's one of these things that's easy to kind of, joke about, but it's like, hey, if they're going to be there for 3 months, we need to make sure that they're safe and that they know how to do this with we're not taking our entire office and shipping it to their home. And so we've done a lot of that. I mean, this last week we had 700 course completions on that program alone.
Wow, that's great.
Yeah, so it's something where I think it's easy to use and it's helpful, and so we're just spending a lot of time with that. I'd say the other thing that both we do, as well as pools that are out there that should be doing, is making sure whoever your third-party claims administrator is for workers' comp, that there's some sort of telehealth type of service that they're providing, because you still have injured workers that are out there, and them going to see their healthcare provider may not be convenient or safe, and a telehealth type of service would be more more safe, more effective, more efficient for everybody.
Do you have any perspective on that yet, about how well those telehealth services are working and how much staying power you think they might have after the COVID-19 crisis?
So we've actually been utilizing them for years. So I think they're really good. I don't think they were utilized as much before, when people kind of looked at like, well, why would I do that when I can go to the doctor? Right. But now people are saying, but I don't want to go to the doctor, but I still need to see my doctor.
Yeah.
So I don't have, statistics in terms of what the impact has been, on it in terms of utilization. But I do know, and I have a friend who's, very involved in healthcare. He's a PA. He actually had COVID that he contracted, and, he's now safe now. But like, he literally spends a day a week as part of his job, right, where he's the telehealth person. And so, he's done that. My wife and daughters, they had an appointment with our doctor, and they did it via telehealth.
Right.
And I think it's one of the things where it's new, but I think people are going to realize over time that new doesn't necessarily mean it can't be effective.
Yeah. And anecdotally, that's consistent with sort of what I've heard as well, that the telehealth services have been really well received and really effective. And so this might be, unfortunately, the crisis that kind of engages that as an ongoing tool and service, which could be beneficial overall.
Sure. Well, I'll tell you. So a comparison on that is, we just finalized the reinsurance for, for the pools and clients that we work with. And so, it's covering about half of California public agencies, are represented in our pools. And so they're massive, placements. I think this is an interesting time that we're in right now. For the last several years, pools have been wrestling with how do we kind of train the next generation of pool leaders, right? As the boomers retire and you have new leadership coming in that may not have been there back in the mid 80s, right, when pools started, how do we help them understand things? Because pools have really served a great purpose. What's happened now is, pools have been around in a very soft market. So there's no true need that people have felt that a pool served, or there was no true loyalty that someone had that they had in the 80s when they couldn't get insurance. Right now they sit there and go, oh, well, there's so many pools out there. It's kind of like shopping on Amazon, right? I'll just go to this pool or that pool. Obviously, I'm being facetious when I say that, but I think with what we're experiencing right now in the midst of a very hard market, and certain areas of the country are affected more. If you're a school district and you have sexual abuse exposure, you have incredibly hard market that you're dealing with. You know, if you have law enforcement liability issues, you're dealing with a hard market. From a property standpoint, it used to be, again, I'm in California, it used to be the hard property market didn't really affect us. That was Florida's issue because they're coastal, right? But now with the new wildfire modeling that's taking place, and what's happening are people are incredibly concerned with what wildfire could be, and there's just an inconsistency of modeling from one reinsurer to another. You know, as they try and figure out what does this wildfire exposure look like. And then you take the COVID situation. So I think as you say, history repeats itself. We're kind of in that environment that we were in the mid 80s. And so what I would say is, for those that are, new into pooling, this is why pools were originally built, and this is the benefit of a pool in that, reinsurers, they may put different exclusions on, the market's going to fluctuate in terms of hard to soft, but the pools are really the stability. The pools are the ones that are going to provide the value from a coverage standpoint, from a servicing standpoint. And I think this is a time when I would hope, the pooling community, does a really good job of helping raise awareness as to, the benefits of pools, and that folks that may not have been involved in pools before really look to their pool as this is a great alternative to, just traditional insurance.
Yeah.
So I think it's one of these things when I always try and find the good out of any difficult, situation. And when you look at a pandemic like this, I mean, it's terrible what the world is experiencing. You asked me, how am I doing? Where do I live? I mean, it's terrible what we're facing. And here I am in Southern California. It's going to be 80 degrees today. And, it's an inconvenience. I'm healthy, but when I look at the pooling world, there's a lot of difficult items that we're always going to deal with. But the good that can come out of this is kind of the reinvention of what pools do and the value that pools provide.
Kind of that unfortunate but really important reminder, and maybe a little bit of a return to some of the roots of pooling to begin with, right? And why we are here and why pools do what they do, for sure.
Absolutely, and I commend you, Ann, in terms of what you've done with AGRiP to help really advance the education and bring awareness on this. So thank you for what you do to help our industry.
And John, thank you again for just taking the time this morning and sharing that insight and perspective. I think it'll be really useful and valuable to our pools. So I appreciate that you took the time today. Thank you.
And thanks, Anna. Be safe.